Hello all. Today we are going to study a very important group of drugs called beta blockers. This is one of the most commonly prescribed drug groups in clinical practice. Before understanding beta blockers, we should first understand why our heart beats faster during stress, why BP increases, and what role adrenaline plays in our body. Only then beta blockers will make sense. So do not rush. Let us understand step by step like a story. Okay. So why does the body need beta receptors? When our body is under stress like fear, anxiety, exercise or emergency, our body activates something called the sympathetic nervous system. The system releases two important chemicals, adrenaline and noradrenaline. These chemicals do not act randomly. They act on specific receptors present in different organs. These receptors are called adrenergic receptors. Adrenergic receptors are mainly divided into alpha receptors and beta receptors. So today we will focus only on beta receptors because beta blockers works here. Okay. So understanding beta receptors in a simple way, beta receptors are mainly of two important types for us, beta 1 receptors, beta 2 receptors. Beta 1 receptors are mainly present in the heart and kidney. When adrenaline stimulates beta 1 receptors in the heart rate increases, force of contraction increases, and the cardiac output will increases. In the kidney, beta 1 stimulation causes release of renin. This renin activates the RAAS system, which finally increases blood pressure. So overall, beta 1 receptor stimulation makes the heart work harder and BP go up. Beta 2 receptors are present in bronchial smooth muscles, blood vessels supplying skeletal muscles, and liver. When adrenaline stimulates beta 2 receptors, it dilate the bronchi and dilate the blood vessels, and glucose is released from liver. So beta 2 receptors are mainly for relaxation of smooth muscles. So now what are beta blockers? Beta blockers are drugs that block beta receptors, especially beta 1 receptors. This means adrenaline is released, but it cannot act on the receptor, so its effect is reduced. In simple words, beta blockers protect the heart from overstimulation by stress hormones. Then I explain mechanism of action. So normally adrenaline increases heart rate by acting on beta 1 receptors. When we give a beta blocker, the beta 1 receptors are blocked and the heart rate will be decreases. This is called negative chronotropic effect. Next, the beta blockers also reduce the force with which the heart contracts. This is called a negative inotropic effect. Because of